And one thing about me, I'm never going to work earlier than I need to. If we have to clock in at 6:45, I'm getting to work at 6:45. Shout out to the nurses who go in earlier and look at the patient's chart and get settled in. But I'll get settled in on the clock. I'm not working for free.
See, videos like that make me nervous. And yes, she is right that most places don't allow you to clock in before a certain time. And I don't know about her, but as a nursing professional development specialist, I see that new grads can be a little bit overconfident in their ability to put two and two together just because they may have shadowed or done a clinical or maybe even were a nurse extern. However, when you're in a nursing role and that title is behind your name and your license is on the line, I will hope that you would have more of a curious mind to really know why it is you're doing what you're doing. It's good to have that time moments before, if it's allowed, to look through the chart, look at the H&P, see why the person was admitted, see how it's contrasting to how they present today, especially if they were in the hospital for a very long time. What is their baseline? What have they been trending as far as labs? That's just a part of fundamentals. When you're a novice, such as Patricia Benner, novice to expert theory, a lot of novices are very task oriented, so they never really quite know why it is they're doing what they're doing, where you're not quite familiar with your surroundings, with the providers, or even with the medications that are normal. You're able to jot things down on your brain, get your schedule set up, and then when you're at the bedside, ask the right questions. Now, over time, will you need to come in 30 minutes before? Probably not, because you already have your skills, you already have kind of your flow, and you kind of know what to expect. But in those learning moments, I think it's important for us to value how people learn. If you need your extra time to get your shift set up, by all means. I prefer that over somebody who's a little bit more overconfident, because 9 times out of 10, that same nurse who arrived early, who was able to look through the trends, is able to catch things and be more proactive in the treatment. Because I would take that over somebody who doesn't take the patient's health or treatment seriously.